Hello everyone and welcome to Dot and Line Academy. In today's medical lecture, we are going to learn about the anatomical position, the anatomical relations and the anatomical movements. So these three are the most general and basic topics of anatomy. All students, all first prof medical students start anatomy from this topic, and today we are going to cover it with the help of some beautiful presentations. Okay, so this complete lecture will be covered in two split videos. Okay, so without wasting any time, let's dive in. Anatomical position. So anatomical position is the position of human body in which the complete study of anatomy is done and its reference is done. What is meant by this statement is the complete study of anatomy is done in this position. So this position is the standard position in which we are going to study the complete anatomy, and we will do the referencing work also, like referring one part of the body to other part of the body. You understand? In physics, we refer, we relate. So to relate, to refer one part of the body to another, this position is important. Anatomical position is important. It is a standard position set under the subject for easy understanding throughout the world. What is meant by this is it is a standard. So anatomical position is a standard position. This position is a standard position in which we will study the anatomy. We will learn all the anatomy, all the things, everything. In every book, in every lecture, in any place, at every place, you are going to learn anatomy in this position. Why it is important? Why a standard position is important is because, like for example, I am studying anatomy here in India. So my friend is studying anatomy at UK. So if I am going to explain anything to him, or if I am discussing any topic with him, he must understand that topic, he must relate that structure, the topic on which I am talking about, through a standard position. If this standard was not there, so I must be saying anything, he must be understanding anything else. So there will be no collaboration, there will be no equality in my statements and in his statements. So we both will get confused. We are going to study the complete subject in this position. What is anatomical position? When a body is erect, when a person is standing and the body is erect, palms are facing forward, eyes are looking straight, and the toes are pointed forward. Okay, these four characteristics are of anatomical position. I am repeating from head to toe. The person is standing straight, erect, the eyes are looking forward, and then the palms are facing forward, the toes are facing forward, pointing forward. Okay, and the complete body is standing straight, erect. This is the standard anatomical position. So I told you about the significance. I am repeating it. It is a standard significance of anatomical position. It is a standard position. Universal language. I tell you how it will act as a universal language. I am sitting here in India. Any friend there in UK, we both will understand the anatomy similarly. That's why I am discussing with any doctor, my senior, any topic I am discussing with him. So he must relate that topic, that structure about which I am talking about, with a standard. So it is a universal language. It will act as a universal language. Less confusion. There will be less confusion if there will be more similarity in the understandings and more understanding. Okay. So I think you have understood. Okay. It is very simple, and why it is important, I have told you. So there are different anatomical positions. There are three major anatomical positions. This is the standard anatomical position. These are not standard, but these are the anatomical positions that a physician, a doctor use to do the different procedures, to do the different examinations, and do different things. Okay, so anatomical position, the supine position. When the human body is lying down, when a person is lying down on a bed with the face facing upward, the face of the person is facing upward, palms facing downward. Okay, palms may be considered facing downward or may not be considered, but the person is lying on the bed and his back is downside and his trunk is upside. This is a supine position. Why it is used? Patient examination. Patient's examination. Let me change the color of this pen. Right. So the patient examination is done mostly in supine position on the examination table. When the examination of abdomen has to be done, the examination of chest has to be done, the examination of upper neck, the examination of the knee, all these things have to be done. The patient is asked to lie on the examination table, examination bench in a supine position. Dissections are done in supine position. The cadaver is laid down in the supine position. Most operations are done in the supine position. Okay, operations of the abdomen, operations of the hip, operation of chest, heart. Most of the operations are done in supine position. What is a prone position now? So it is the opposite of supine position. Okay, when a person is lying on his chest, on his trunk, and the back is facing upward, this is a standard prone position. It may be considered that the palms are facing downward, like if his hands were like this. It may be considered, it may be not, it is not included, but the main thing is that the subject has to be lying on his trunk like this. Okay, then it will be considered a prone position. Many examinations, excepting the examination that we cannot do in the supine position, we will do in the prone position. Example, we have to examine the vertebrae, we have to examine the hip, we have to examine the back of the neck, we have to examine the flexion of the knee. All these things will be examined in the prone position. Some operations like the operation of vertebra will be done in the prone position. So this is the importance of prone position. Lithotomic position. When the human body is lying down supine, like you can see the body is supine, and the hips and knees are flexed, the hip is flexed, you can see the hip is flexed, the knee is flexed, the hip and knee are flexed, and the feet are stretched, or rather strapped in a position. It is strapped, it is rested on a platform and it is strapped. This position is important in females when a physician has to examine, or surgeon or a gynae has to examine this the female's uterus, female's vagina, female's genital organ, then this position is important. Patient examination is done sometime in lithotomic position at the examination table. The patient is asked to lie down in the lithotomic position. Some operations are done in supine position, not supine, lithotomic. Okay, and delivery is also done in this position. Okay, this is the importance of lithotomic position. So now coming to the another topic, the anatomical planes. This is also important. We should know what are the anatomical plane and why they are important. An anatomical plane is a hypothetical plane used to transect the body in order to describe the location of any structure or the direction of movement. It is a hypothetical line through which we transcend, through which we cut in order, why? To describe the location of any structure. To describe the location of any structure, we cut that part, we dissect through any plane, and we give the direction of that movement. There are majorly, I've written 5, but the main are these 3. These 3 planes are very important: sagittal plane, coronal plane, transverse plane. These 3 planes are main, and a subclass of sagittal is mid-sagittal, and there is an oblique plane that is at any angle. All these planes when are at any angle, then it will be considered under oblique plane. So the color is related, you will understand. Like for sagittal plane, this green plane, this is a mid sagittal plane because it is cut from the midline. But when we cut when we cut the subject from beside midline, from here or from here, when the body is divided in two halves, that means in left and in right, then the sagittal plane, we will say that the body is cut through a sagittal plane. Okay, so when this plane is passed through midline, from the mid, this, let me rub it, it is getting very messy. This green line which is passing through this subject, that is the mid sagittal plane. You understand the sagittal plane. Coronal plane, when the body gets divided in front and in back like a mirror, this red will be passed through the body like a mirror, and it's divided in front and in back, in front and in back. Then it will be a coronal plane, frontal plane. It is also called frontal plane. And transverse plane is like TS. You know TS, right? We all have done that experiment of stem and root, and used to make slides and used to observe them under the microscope. Remember, we used to take TS and LS of the roots, the stems. So when we cut the subject through a transverse plane, it will be a transverse plane, horizontal plane, transverse section, TS, right? Let me tell you with an example, like in a skull, in the case of a skull, what will be the different planes. So this, let's consider this plane. What is this plane? This is a sagittal plane. Okay, why? Relate it with this image, this green section passing from the mid, dividing the subject in left and in right. So it is a sagittal, and specifically it is a mid sagittal. Can this relate it with this image? Yes, this one. In left and right. In front and back. So in front and in back. So it is a what? Coronal plane, right? Coronal plane. It is a sagittal plane, and in this, very simple, purple transverse plane, right? Right or wrong? Right. We are transversely cutting the body, transverse plane. So it was like an example. Now coming to the topic, that is anatomical relation. It is having the same amount of importance that the other topics that we have studied. We all must know the anatomical position, the anatomical relations, because the complete anatomy that we are going to study in the first year, and afterwards when we will relate that anatomy with the pathology, the other subject, gynecology, the surgery, then we have to understand, we should have a clear image, clear picture of these topics, because it will be repeated. These words are going to be repeated again and again throughout the subject. You must have heard these names, right? Anterior, posterior, medial, lateral, superior, inferior. So what? These are opposite of each other. These are opposite of each other. And these are opposite of each other. But what are these? First, let me explain you what is the anterior. Any body structure that is towards the front of the body is anterior. The nose is anterior, the chest is anterior, the abdominal wall is anterior, the kneecap is anterior. Any body structure that is in front is anterior. Now opposite, simple, posterior, at any structure that will be at the back, like this scapula is posterior, the hips posterior, the lumbar vertebrae posterior, the gastrocnemius muscle posterior. You're getting na? Or anterior, that is on the front. Another name of anterior is ventral. Posterior in the back. The another name is dorsal. Anterior is ventral, posterior is dorsal. Okay, now medial and lateral. So this image will not explain the medial lateral. Let me take any other image. Yeah, I will explain it on this. Like the body's structures that are near the midline. Near the midline, they will be medial. The away from the midline, they will be lateral. Like for example, heart and shoulder. Heart is near the midline, medial. Shoulder is away from the midline, away, that means lateral. Another example, eye, ear. The eye is near the midline, medial. The ear is lateral. Okay, you got the point, right? Medial and lateral. Superior and inferior. When any structure that is above the body, not above, upside of the body, near the head of the body, okay, it will be superior. You understand the word superior? It is an English word. Anything greater at upper position, right? Upper position, that is a perfect term. Anything that is at upper position is superior. Anything that is at lower position will be inferior. You understand? Anything that is near the head is superior. Anything that is near the foot or near the tail, it will be inferior. That's why the other names for superior is cranial. Anything that is near the cranium. Anything that is away from the cranium and near the tail is inferior. But it is not necessary, because the foots are also inferior. So anything that is near the foots, downside, downgraded, is inferior. Then anything that is upside, at upper level, is superior. So these were the relations. There is two terms more also used, that is proximal and distal. Anything that is away from the body or from the body is distal. Anything that is close towards the body is proximal. This proximal and distal are mostly used in upper and lower arm. For example, here the hands are proximal, the shoulder is distal, and if you are relating the elbow to the hands, then the elbow is distal, the hands are proximal. In the case of this lower limb, this foot is distal, this knee in relation is distal, the foot is proximal, the foot is proximal in relation to knee, and the knee is distal. But when we will relate this knee to hip, so then the knee will be proximal and the hip will be distal. So it's all about the relation. Okay, anything when relating with any other thing may be proximal, and when relating to any other thing it becomes distal, right? So we have to relate. It is not fixed. Like for example, I'm repeating. Let me explain you with another example, like that of clavicle. Let's take this clavicle, and here let me rub it. You will get a clear picture. Okay, so this clavicle, there is humerus, there is manubrium. Okay, the upper end of the sternum, the manubrium. This clavicle, this end of the scapula, or you can say the humerus. The humerus will be good. So this clavicle, when we relate it with humerus, these two things, then the humerus is lateral and the clavicle is medial. But When we relate it with manubrium, remember the clavicle is lateral and manubrium is medial. So sometimes the clavicle is lateral and sometimes the clavicle is medial. So how it is specific? No. You have to relate, you have to apply the law, right? Just like physics. So it is not fixed that any structure is just lateral every time. It will be lateral. No, you have to relate, you have to think that in which reference, in which context we are talking about. Now coming to the movements